Winni Mobile Health is an example of a mobile integrated health program, which basically means we're trying to deliver care where people are. So that means in the home and the community, instead of forcing people to come to the hospital. And in a rural area like this, transportation can be a real barrier for that. It's also aimed at reducing ER and EMS utilization, and we've seen some real success with that. So for example, we have one high utilizer who in, I think 2024, the calendar year, used the emergency room, I think 63 times, and that is more than once a week. And since introducing them to our lovely community paramedic, Winnie Tunstall at Laconia Fire Department, that number has drastically reduced. Having an advocate, having someone who's there and will answer your phone calls and will listen to your concerns can really limit someone's over-reliance on services. So our program has two main parts, and it's the community paramedic side with the Laconia Fire Department, and then we also have our community health workers side, and we're really excited about that. So that's all about resource navigation and health coaching, and that allows us, within the ADRC, we already do some of this work with resource navigation, but this allows us to spend more time with each person, do more follow-up, and for those higher needs people who maybe can't do the follow-through the way that we'd expect based on a single phone call, we're providing those people with resources. To date, we have received about 115 referrals. Not all of those we made contact with, obviously. You know, a lot of the times the people that we are being told to reach out to, you know, they've talked with someone in the hospital and they're saying that they need resources, but a lot of times they need resources because they are harder to access. So we're making phone calls, leaving voicemails, but of those, I believe half of them we've done home visits with, and that's a great metric. As of now, we're about a year and a couple months into originally receiving the grant in October of 2024. So in our past year, we have easily exceeded our early metrics. We set the goals pretty manageable, not knowing how this would turn out, how long things would take to get started, and we've really blown the numbers out of the water.